Welcome, everybody. Thank you so much for taking the time to join us today for another really, really interesting webinar that we're going to have for you today. So I have three really great guests that are all going to introduce themselves in a second here. Before we do that, I just want to kind of give you a brief introduction and kind of give you a quick summary about what we're going to talk about. So my name is Mike Papali. I'm the manager of community relations here for Defibtech. And I know we talk about this a lot, but we're really proud of it, and it's really important to us. And that's our mission. And our mission, being an AED manufacturer, is ultimately to help save lives from sudden cardiac arrest. So one of the ways we do that is we partner with many great nonprofit organizations all throughout the United States. And really, what those organizations are doing, and again, you'll hear more about them, is they're in their communities on the ground doing things to make sure that when someone suffers sudden cardiac arrest, they have the absolute best chance of survival. So we're really happy to have three of those organizations with us today. And the goal for today is two things. Number one is to, first and foremost, hear the amazing work that these nonprofits are doing. And next is to talk about the Access to AEDs Act, which was introduced just about a month ago in Washington, D.C., and it was an event we all attended. So we're going to hear a little bit about that and about the potential it has to help save a lot of lives. So if you have any questions, as always, you can throw them at the bottom of your screen. There should be a Q&A box. You can throw them in there, and we will keep an eye on them and answer them at the end. So without further ado, I'm going to allow everybody to introduce themselves here. So I'm going to kind of go in order of how it is on my screen. So I'm going to start with you, Jessica.
Hi, I'm Jessica Cook. I'm the executive director at Living for Zachary. Do you want us to talk about?
Do a quick introduction about your organization as well. That'd be great.
Okay, great. So our mission here at Living for Zachary is to raise awareness and prevent sudden cardiac arrest in youth. We do that by offering youth heart screenings for ages 12 to 22. We donate AEDs to Texas-based youth organizations. We provide CPR to the community and also scholarships to a couple of our sonography schools here in Texas.
Awesome. Cool. Jen?
Hi, everyone. Mike, thanks so much for having us. It's great to see Jessica and Christy here as well. Simon's Heart started 18 years ago when a little boy passed of sudden cardiac arrest. Our vision is a future in which communities and parents do not lose children to detectable and treatable heart conditions. We do this in a few different ways. We provide free heart screenings to community members. We provide AEDs where children learn and play, and we teach CPR education through our unique CPR Jukebox initiative. We also have a large advocacy pillar in which we invite legislations and legislators to come in and prevent sudden cardiac arrest with us. So this is a great opportunity to just talk through that a little bit.
Awesome. Great. And Christy?
Good morning. Thanks for having me. I'm Christy Brinley, and I'm one of the founders of the Just One Mike Foundation, which was started in 2017, a year after our family lost our youngest son, Michael, who was just 16 at the time, to cardiac arrest. So he is our inspiration in all that we do. Our foundation work started in the Chicago area, where we raised our kids with funding heart screenings. We partner with other organizations to facilitate them. And a move to California has put us in Sonoma and Northern California. So we've brought Michael and Just One Mike here. We are helping to fund heart screenings in this area, continuing to work in Illinois, and we've expanded now into an AED donation and partnership program.
Awesome. Great. All right. So the first thing I just would be great to talk about is kind of, I know you all are involved with donating AEDs. And I know one of the things we try to talk about, like at Defibtech with our marketing, is like donating an AED and buying an AED is great, but just getting an AED and like throwing it up on the wall isn't really the right way to do it. It's really important to have, a complete program. So if you all could just take some time and just talk about kind of like your AED donation programs, kind of what they entail, and kind of what goes with placing an AED at an organization. So for this one, Jen, we'll start with you, with Simon's Heart.
Thank you. So we have our founder, who's Simon's dad, really developed our AED program a few years ago for a couple of reasons. We call it .aed. You go .aed.org and you can crowdfund for an AED for a community that is in need. So a community like mine, we can, I can go out, I can text 10 mom friends, they can all donate, and then we'll have the AED in hand within, well, we won't talk about the backlog of AEDs right now, but we will have it in hand as soon as possible, right? But what we also realize at Simon's Heart, and a lot of our sister organizations know, is that health equity is a real issue. So not everyone can text their friends and at $25 at a time get enough to fund that AED. So we provide free AEDs to community partners that really need them, where children learn and play. And we do that through wonderful sponsorships and grant funding that we've received over the years.
Awesome. Cool. Chrissy?
Sure. So our program is both donations and partnerships. We've shared our story with people in both the communities where we lived, and have had tremendous support in helping to fund some of these where we can do it fully. Otherwise, we're partnering with some of the groups that are in touch with us. One of the things that is really important in our program is if there's almost a contract involved when we make this partnership. So we're happy to help donate these things, but there has to be a commitment in terms of maintenance and developing an emergency action plan so that this AED is always ready if there's an emergency, and everybody knows what to do. And I think we're refining that as we go along, but that's the partnership part of it.
Cool. Awesome. And Jessica?
So we started our AED program in 2009 when we were first founded. It's definitely evolved since then. It starts with an application. So we have youth-based organizations go online, they fill an application giving us basic, where the AED is going to be, how many people it serves, things like that. And then we have a committee that reviews our applications, determines how many the organization needs based on building size and all. And then once they're awarded the AED, we do go in and we certify key leaders or people that are going to be there in the building. We try to at least do 8 to 10, but we get them certified in CPR and teach them how to use the AED, because I definitely believe education's the biggest piece of, having it there is great, but if you don't know how to use it or you're scared to use it, an issue. So we do provide that CPR education. And then we actually just launched a Super Hearts school program where we go into schools, and it encompasses all of our programs, but we also place AEDs in the school. And with that program, we also do a cardiac emergency plan with the school, so they know what to do in case of an emergency.
Awesome. Cool. So, all right. So just to switch gears a little bit, and we were talking about this a little bit before. So I know you're all kind of involved with screening as well. And I think screening is really good thing to talk about, because I think it's just an educational opportunity for a lot of parents to hear about the work that you're doing and consider reasons why they might want to get their child an ECG. So I'll start with you, Christy, and can you talk about kind of your involvement with screening, and also, why you believe in it and why you think it's important?
Sure. Our involvement started in Chicago, and we happened to be next door neighbors to the Young Hearts for Life screening program, which is one of the largest in the country, if not the largest. And we didn't really know that much about it, to be quite honest, when we got started. But once we learned what they were doing, and we were looking for a way to honor Michael and his beautiful spirit in giving this to others, we were able to partner with them and watch this, this amazing operation. And the real belief came at Michael's high school. So that was the first screening that we funded, where it's a big high school. All the kids had the opportunity for a free EKG that day. And 1,800 kids were screened on one school day, and 13 were identified as abnormal. By 3 o'clock that afternoon, 5 had been definitively diagnosed with Wolff Parkinson White. So it was just an incredibly powerful day. And since that time, and now that we have formed some partnerships in California as well, there has not been one screening that we've helped to fund that at least one child, and usually it's multiple, have been identified. So it's such a powerful tool. Every child should have this opportunity.
Definitely. Jessica.
Yeah, so our heart screening program is incredibly important to us. So Living for Zachary was founded in 2009 after Zach passed away. He collapsed at football practice with cardiac arrest, and his family had no idea that he had anything wrong with him. He'd always had a physical, he was healthy, played sports, hunt, fish, like all your typical teenage boy things.
Mm-hmm.
So for that to happen and not have a clue that something was wrong was the big reason that we wanted to get a heart screening program, so that we could, help other families identify and, their children if something was wrong, so they could. A lot of times it's a simple procedure to be able to fix that, or medication to monitor. And we wanted to make sure other families had that opportunity.
Jen?
Yeah, so I just echo Christy and Jessica's comments. Simon passed away of a treatable heart condition that could have been detected. His mom has it. So, we've been telling this story for a long time. We know families this year, one family in particular, their 19-year-old daughter passed away, Caroline Kyle. I'll say their names because it's so important. And what happened was dad was diagnosed, sister was diagnosed, the grandmother, aunts, uncles, cousins, a lot of folks on dad's side. And, that's why aren't we able to detect these things early on, so we don't have to have these tragic stories, but success. So at Simon's Heart, we're really dedicated to changing the standard of care. So we in no way, shape, or form can screen every child in America, right? Even all these wonderful organizations that are doing it, we cannot do that, which is why we have to pass legislation. We have to work with the insurance companies, and we really just have to get the doctors and physicians on board, because as we know, there are many differing opinions over supply and demand. So we really want people to know that kids are dying unnecessarily, and this is what you can do to prevent it. So those heart screenings offer both an opportunity for children to have a huge impact. Like Christy, those numbers, same as me, right? Like we just screened only 200 kids, 5 heart conditions. Every screening we've had, even through COVID, has caught something. And that's great news, because those kids will probably go back to play. Their lives are changing, but not just severely like they would in the unfortunate circumstance. So we really just want to work harder to create that awareness. So they provide the actual screening to those students and families, but they also create this incredible awareness for it. So when the news comes or someone else comes, then we're getting calls and saying, oh my gosh, I didn't know this existed. So it's double-sided. Let's do those real screenings in real time, but also document so we can provide more awareness to others.
Definitely. A couple points. Everything that you all said, I obviously totally agree with. And I know the big thing for us, the words we always use to people, is just like primary prevention. Sudden cardiac arrest is, it happens so much more than people realize. And unfortunately, AED placement is so important. CPR training is so important. AED training, it's all so important. But we want to try to catch these things before someone's in that situation, because we know that when someone does go into sudden cardiac arrest, the chain of survival has to be done really, really well for that person to survive. So what we can do with screening is potentially detect something in somebody before they're in that situation. So that was one thing. And the other point was, and I think, Jen, you just brought it up, because we just had an instance of this, which was really interesting. Just because something is detected, it doesn't mean the athlete's life is going to drastically change and never going to be able to play a sport again. It's every situation is treated differently, but there are instances where kids will go back and play and be treated, and the knowledge that they have now that they do have this disease could also be potentially life-saving. So, because we ran into that at some of ours, where it was like kids didn't want to do it because they're like, well, if I do it, then I can't play football anymore. And that's not necessarily the case. So just really, really important piece of this whole, piece of all this work that we're doing. So going to talk about some CPR and AED training. And I just kind of want to get your thoughts on any like messaging that you provide, like when doing training. So I think there's all different levels to training, right? There's people who take like certification classes, people, just, I know what we do is we just go and educate people. We're not necessarily training people, but we're just doing a demonstration of how to use an AED. Is there anything in particular, like messaging wise, that you try to deliver when it comes to, how to do CPR, how to use an AED? And Jen, I'll start with you for this one.
Yeah, so we have a really unique CPR initiative called the CPR Jukebox. You guys might have learned CPR through the song Staying Alive, right?
Yeah.
So young kids these days don't know that song, which is hilarious, except for there is a new Lizzo one out. We know that, but we know that the reason that song is part of a training is because it goes 100 beats per minute.
Mhm.
So we have the CPR jukebox. It's a giant inflatable jukebox, actually. And we have a playlist on Spotify of hundreds of songs that go between 100 and 120 beats per minute. So we bring kickballs with us. We have the CPR jukebox, and we always have a speaker to play music. And so we say, pick a song, grab a ball, push to the beat, surprise, you're learning CPR. And so it's not an official certification, but what we're trying to do is make it more user friendly so that way folks aren't afraid to approach a person when they go down. So it's a really unique way. We brought it to, sporting events, but also community events. We bring it to high schools and elementary schools. We travel around with it. And what we find is when they're in there with us, they're having fun, they're playing music, but they're also really learning the chain of survival. So we talk a lot, usually when it's younger kids, even adults, I like to say, what's the first thing that you do? And they always forget to call 911 first. So it's just a really fun, unique way. We say, saving lives is serious, but learning how can be fun. Usually at those events too, they're learning how to use an AED as well. So we typically will have a dummy with us, but we like to have those balls out and teach folks how to do compressions to those songs.
Awesome. Jessica?
So we do both. We do certifications, especially with our AED donations, but we also do with our community, like hands only and just letting people practice on the mannequins. But something that's really important to us is providing the education of what are the signs and symptoms of SCA. Mm-hmm. And we actually did, with our Super Heart Schools program, we were doing a hands-only like demonstration and talking to the student body about SCA and like what it is and what to look for, and then showing them hands-only CPR and AED usage. Well, we had an 8th grade student the next day. He went to the school nurse and said, hey, I was at the Living for Zachary seminar yesterday and they were talking about shortness of breath and like rapid heartbeat. And I have that. Like my heart does a lot of those things that they were talking about. And so the nurse reached out to the family and they took him in. He had a heart screening with his cardiologist, and come to find out he had Wilparkinson-White. So I think the education piece to me is just, very important.
And Christy?
Yeah, we are a very small foundation, so we don't have a formal program, but we, again, we're partnering when we do things. So when we're going on an AED donation, oftentimes we're working with the local healthcare district who's coming and helping to provide a training, or we've partnered with our fire department here locally. I guess our message is really just how easy it is and to practice. So when we've had dedications or donations, we have people that can actually practice, with the firemen giving a quick demonstration. And the only bad CPR is no CPR. What a critical step it is in all of this.
Definitely. Yeah, I know that in both, so I've been involved in both sides of, but like just showing somebody like the CPR jukebox, like or just by you showing an AED trainer, it's just so important, I think, for people to realize, what to do, that you can help. You don't need certification. You don't need special medical training. Anybody can step up and do it. And then when it comes to AEDs, I know a lot of the two main points that we always try to make are, number one, just turn it on and listen to it, and it's going to tell you what to do. And then the second thing, which I think is there's still a big misconception in society from we see, is like people are afraid to use them because they don't want to hurt somebody with them. And it's like, all you have to do is turn it on and listen to it, and the machine's going to analyze and determine if a shock is needed. If a shock is not needed, you're not going to be able to deliver a shock. And that's where I think people still have a big fear of like, oh my gosh, like what if I use this machine and I shock somebody and they don't need a shock? Could I hurt them? And the machine will analyze the heart rhythm and determine if the shock is needed. So, but I want to take a second and talk about, and we've all you've all done this already, but I want to make sure if there's any other big success stories, safe stories, anything you want to share in terms of like success that you've had with your organization. I just want to make sure we have a chance to talk about that. So I'll start, Christy, with you for this one.
Okay, sure. We have an amazing story to share that just happened almost a year ago, last June. So we've been in our new community almost 3 years, and we had just completed a substantial donation to our local high school outdoor sports complex in February. At the end of February, it was completely installed. And in June, last summer, we had a call that a young man had been playing basketball and collapsed and went into sudden cardiac arrest. And the AED, one of the AEDs that we had donated, was used. So this was on an outdoor basketball court. We had an outdoor safe station tower with an AED just steps from the court. The young man's name is Mikey. He was 16 years old at the time. He has made a full recovery. And there's just a lot of meaning to the story for us because our son Michael was 16 years old, also playing basketball. So there's just so much going on there. And the other part of that story is one of the reasons he did survive, first of all, and make this recovery was his friends playing basketball with him knew what to do. They were just 18 and 19 years old. There were 3 of them. So it was the textbook definition of the cardiac chain of survival. One called 911, one started compressions, and the third one grabbed the AED. So that has changed our lives yet again in this work on how that's done. And just a little side note back to our screening conversation, we've since learned and had permission to share that Mikey, of course, they found an underlying heart condition for the reason that he went into cardiac arrest, and that perhaps could have been one of the ones that would have been detected on one of the EKG testings. So there's just so much power wrapped up in one story, and this is just one that we've experienced. I know there's so many more, but it's certainly what keeps us moving forward as fast as we can.
Yeah, it's amazing. Yeah, Jessica?
Yeah, we have a few. So our very first AED that we donated actually saved, he wasn't a youth, he was an older gentleman, but it saved his life. And his name is Mike as well. But he now volunteers his time. He serves on our AED committee. He provides CPR trainings to a lot of our Boy Scout troops and things like that receive our AEDs. So it's been really amazing to see him give back and continue to partner with us. And he was incredibly grateful that AED was there that day. And then we had a story this summer. One of our Boy Scout troops that we had donated to went on a camping trip. They were in Yellowstone, and they brought their AED with them to have on hand. And when they pulled up, they were parking, they were going to go hike. Someone ran up to them and asked if they had an AED, that a young woman had just collapsed. They were trying to call 911, and they did. They had the AED, so they were able to run that over to her, start CPR, and do the AED and save her life. So that's just two of our amazing
awesome
stories.
Yeah, Jen.
Those are amazing. Those are hard. Those are hard stories to follow. I just wanted to flip it to the heart screening side. You know, we've screened almost 19,000 hearts. 134 of those kids of hearts we've screened have been saved. I was just chatting with one of the mothers of a child that her heart condition was found. At one of our heart screenings, and that it's so meaningful every time you speak to one of these families, because then they have an opportunity to speak to other families that have also been impacted. So at our last heart screening, one child who her life was saved by an AED, she was able to speak to a mother whose daughter was recently diagnosed and really talk through all of the questions. Like, what do you do? How do you do it? What doctors do you have an implanted IUD? Like, how are you, how did you move forward with learning this information? So for me, the success is the detection and also the save, but also that community that has been built around, so they have someone to communicate with when they're going through this.
Definitely. Yes, that is, well, speaking from a patient perspective, that is so important. Being able to connect with people that have gone through something similar that you're newly going through. So, all right. So I want to talk about the Access to AEDs Act. And just for everybody listening and watching, I'm going to take a quick second. I'm going to read, just I don't want to mess it up. I'm going to read a quick summary about it, just so everybody has some background, and then we can kind of talk about our experiences with it. So the Access to AEDs Act is a bipartisan bill that directs the Secretary of Health and Human Services to award grants to public and private elementary and secondary schools, partnered with a nonprofit healthcare organization to develop and implement a comprehensive program to promote access to defibrillation in their schools. The funds can be used for things like purchasing AEDs, batteries, maintenance, replacing old and outdated CPR and AED equipment, providing CPR training, CPR and AED training to student, staff, and related sports volunteers, helping develop a cardiac emergency response plan, and really anything surrounding the AED program at the school. So that's just some background for everybody. But the four of us and many others were able to kind of experience this briefing in Washington, D.C. last month. So before we talk about the briefing, I know the night before we were able to kind of get a really good group of people together, organizations like yours, and the three you were there, of course. But I just want to talk about like the importance of like that collaboration, and what that means to be able to kind of partner with other organizations that are doing similar work and have similar stories. So Jessica, I'll start with you for this one.
Yeah, that was the first time I was able to meet other leaders from the SCA organizations. So it was very impactful for me. I loved getting to know, we're all doing the same thing in like different areas, and it's like how to, coming together and really joining forces to be able to get the message out, because it is, it's still so kind of taboo almost, like people just don't know about SCA. So I really enjoy just meeting other leaders and finding out like what they're doing in their areas that, is it something that we could be doing here to help spread awareness? So yeah, it was very impactful for me.
Awesome. Jen?
Yeah, I echo that, Jess. I think that the collaboration that is possible from this extremely powerful group is amazing. I mean, we can ask questions to each other of like, oh, what's your preference, or how are you handling, like before we started this call, how do you guys do heart screenings? How are you performing them? Who's paying for that? How are you sponsoring it? What's that heavy lift? And by the way, also to have peers in which you can say, whoa, this is a heavy lift, and to be able to support each other. For me, the meet and greet, to hear every single story from every family that were there was so powerful. I represent a family that lost their son. In particular, meet Jessica, who also is an executive director, represents a family that lost their child. And to meet Christy, who is someone that did lose her child. I think that all of that allows for us to get energy and to be optimistic about our future because of how many organizations are out there. I think there's such opportunity to do research and collaboration to prevent SCA.
Christy?
Yeah, I fully agree with everything that you both have said. Maybe I'll add, just from the perspective of a family who has lost a child, what just how emotionally important that connection is. To be with others who understand and are working hard, and to be able to lock arms with that whole group. I just find everybody so inspiring, and I always stand in awe at what's being done. I feel like there's much more to do, but when you get in this group, you feel like one of many and just not on your own.
Cool. All right. So to talk about the Access to AEDs Act. So I know, like, my feeling on it was like, and Jen, you might have said this before, it's really important to have all these organizations on the ground doing the work that they're doing, but real change does happen with legislation. So I want to give everybody a chance to kind of talk about their feelings on this. And, I know for me, I was like, wow, like, my sudden cardiac arrest happened in 2006, and I've been really focused on doing a lot of this work since like 2016. And this was one of the big wins, I would say, since we started. So, Jen, I'll start with you. What were your thoughts kind of on hearing the news about the act and maybe, what it looks like for the future?
Yeah, so when we were first invited to co-sponsor, my first question, and it still is now, is to be the squeaky wheel about that budget. I am so happy to support the bill and so glad that it's finally at the forefront. And it is such a unique thing for, I think, Damar Hamlin, for everything that happened publicly and for our organizations. But when I see the budget numbers not great enough to really support all of the AEDs that we hope and dream to be everywhere, I'm going to always be that squeaky wheel to push that forward and to raise those dollars. But in general, I think, what a neat experience it was. We actually brought a SCA survivor with us, Kai Bates, and Kai collapsed on the basketball court, and he had never met a survivor. So, Mike, I know he really appreciated meeting you, and for him to be in that room and see other survivors was really powerful for him, and I think really emotional to hear of the families that had lost as well. So it's the tip of the iceberg for us as we sort of move this needle forward. But I'm always going to stamp my feet for more dollars committed.
Of course, Christy.
Keep stomping your feet. I'm with you. Absolutely, absolutely. Although I think it's a great step forward. It was incredibly emotional to be there on many fronts for me. But I found it so meaningful because maybe for the first time outside of the group that we're all in, and the other families that I know, it felt like something was actually going to change and something was actually going to be done. And most importantly, this message of all the lives that have been lost and are continuing to be lost to cardiac arrest is finally, I feel like, being heard. Not loud enough, certainly. I don't think I'll ever feel like that happens, but at least it's got some national attention and a national spotlight on it. And I do think that some positive change will come from that. I mean, having a Damar Hamlin, an NFL football player, what we all witnessed, and now having his voice. And I just give him all the credit in the world to step up after something so traumatic. And like you, Mike, I mean, putting yourself forward to help educate and move this along is amazing. And personally, on that Damar Hamlin front, my husband's from Buffalo, and we are huge Buffalo Bills fans. Our son Michael was an enormous Bills fan, so that piece of it too was pretty amazing.
Yeah, definitely. Yeah, Jessica.
It was very inspiring to be there, and I think Christy, I think you said it gave you hope. I feel that same thing. Like, it gave me hope that there's so many organizations and we're doing the best that we can with the funding that we have, but gosh, just think of how many more hearts that we can touch with additional funding. And it gave me a lot of hope that it's there and we'll be able to do that. To keep, if it's just one child, if we save, one heart, means a million. That's just everything to me. And then also, so Jen mentioned Kai being in Washington, able to speak with him, and he shared with me that he had met another survivor, and I felt grateful that I was able to actually connect him with one of our survivors that had collapsed at track practice, and connect them, having like that same age with college students, and so I've since hoping that they continue that and kind of create a friendship and have something in common. So
yeah, it was a good group of people in the room. I will say both events were a really special group. All right, I want to kind of look towards like the future of, I guess this would be more of like I don't know, like a wish list or like what's your ideal situation. But I think all of our goals are ultimately to decrease, or I'll start to say like this, increase the survival rate from sudden cardiac arrest. So we want to lose less people from sudden cardiac arrest. We want to see the survival rate and the numbers, go up for people surviving. So I just want to kind of hear your thoughts on, what do you think really we need to do as a society or communities, like to make that happen? Like what really, what can we do in your perfect world in 15 or 20 years? What's different that we can help improve survival rates? So Jessica, I'll start with you for this.
Yeah, I've said it a few times already, but I go back to the education and awareness piece. What happened with Damar, like Christy said, brought so much awareness to everyone. Because people they don't know that it's happening. And so I think us spreading awareness and educating the world on hey, this can happen and here's what we can help prevent it. Is it going to work every single time? No, but how many more lives are we going to save? If someone knows to start CPR, they know that, or they know the chain of survival. So I always go back to the education and awareness.
Yeah. Jen?
Yeah, I totally agree. Having that education piece implemented in every school would be amazing. That for me is the future. And then also really taking a focus on health equity. We have to educate and get the buy-in from schools that really need our support, ones that could not normally provide this to their students because they have so much other things going on. So for me, it's that health equity piece in creating that awareness. Each area and territory is different, and I think the more certainly the more help you can provide for someone that is at risk. And then also you can teach others for what's going on. So really having a required educational piece for us in schools would be just really tremendous.
Great. Christy?
Yeah, I echo that as well. I mean, the education is fundamental on all of this. If you're giving me the wish list for the perfect situation, it would be all of what these ladies have said, but that everywhere I walk around, I am going to see a publicly accessible AED. And then everybody's going to know why it's there and how easy it is to use. But I think we have a long way to go on that, and we need to have them everywhere. And it's a big hurdle that we found, and I hope we can all get over this at some point soon, that it doesn't have to be in the nurse's office, or it doesn't have to be in the Little League shed. It needs to be right there by the field, by the shopping mall, all of those things. So I'd love to see those everywhere I go. And I also would love to see that the EKG testing, it becomes a standard of care in all children, so we can prevent so much of this from even getting to that point. But then we're ready for, those people who are in need.
Awesome. I totally agree with everybody. I think, and I'm sure we all feel this way. There's an overwhelming amount of work that needs to be done. But I think the more and more people that we can make aware, and the more people that are helping and doing it, we're going in the right direction. So, all right. So as we wrap up, I want to give everybody a chance for last thing is I want to give everybody a chance. Number one, if there's anything I missed or anything you want to add about your organization, please feel free to do. But I also want you to share any contact, social media, website, any information that people can have. So if there's people watching, whether it's live or this will be broadcast on our YouTube channel, that they can reach out, get involved, maybe make a donation. So if you all could share again any last thoughts about your organization, and then just contact information. So Jen, we'll start with you.
Yeah, so thank you so much for giving us this opportunity. It really means a lot to shine a light on SCA and also to partner with these wonderful organizations. Of course, our website, simonsheart.org. You can follow us on all the social channels and look at us up that way. We provide heart screenings here in Pennsylvania, New Jersey, Delaware, but also, we provide those AEDs around the country. And we also provide our CPR Jukebox initiative around the country. So no matter where you are, we can help you protect hearts, save lives. I just want to say a big thank you to Defibtech. It's really cool that you practice what you preach, and that is not as common as we would like.
Yeah. Jessica?
Yeah, first, just thank you, Mike, for having us today. And yes, like Jen said, a big thank you to Defibtech. You guys have been a great partner. We gave out over 100 AEDs this past year, and it's because of the great partnership that we have with you all to be able to do that. So to find more information about us, livingforzachary.org. And again, we're on all the social media. You can search Living for Zachary. We serve the DFW Metroplex here in Texas for our heart screenings, but we serve all of Texas for our AED program. And I said before, we have applications on our website. So please, if you do have a youth-based organization, we'd love for you to fill out the application so we can get you an AED.
Christy.
Thank you, Mike. And it's been an honor to be here with you guys this morning. It's wonderful and inspiring. And Mike, you've helped me learn so much through this. And very grateful to Defibtech and the partnerships that have been formed. We're just a family organization. It's strictly volunteer. But we do have a website. It's justonemic.org, and we're on Instagram and Facebook and Twitter. It's Just One Mike B. You can find us. But yeah, we're just thankful for any kind of partnership or donation to keep all of this work for all of our foundations moving forward, and really appreciate the chance to join you today.
Awesome. Thank you all. So we had a couple questions come in that I just want to cover really quickly. So one person asked about, are you aware of an organization that focuses on faith-based churches / synagogues? So unless you all have a different answer, I would say, a lot of them are more low geographically based. So I can reach out after this and find out exact locations and kind of refer to organizations that are in those locations. And then someone asked about a copy of the proposed legislation, which we can definitely provide. So we will work on getting that out to people that registered for the webinar in a follow-up email. So, all right, awesome. Well, thank you all for taking the time. It was great seeing you all. I'm sure I'll see everybody soon, and keep up all your great work. So thank you, everybody, for joining. Have a great day.